Hi, this is Justin Lubino with Senior Advisors, and I'm here today to talk to you about the number 4 biggest mistake we see people make on Medicare. This comes from our free guide, which is on our website, for the top 5 mistakes we see people make. And just the past week, we've had several cases which individuals made this mistake, the number 4 biggest mistake we see on Medicare. So what is the number 4 biggest mistake? It's not properly analyzing your retiree medical coverage. Okay, so there's a lot of cases where retiree medical plan may be the right option for certain individuals. Some examples are either a state worker or a public teacher who worked the necessary number of years and was able to get the retiree medical benefits for little to no premium per month. But there's a lot of other cases where individuals have a retiree medical plan that they pay a lot of money for, and it's not the right cost-effective solution for the individual. So what do we look at when we do the analysis to determine if the retiree plan is the right option for the individual, or if they should leave the retiree medical plan and move to a Medicare supplement and a prescription drug plan? Well, the first thing is the premiums. So this is the most obvious. If the individual is paying more than $200 per month, we generally continue the analysis to see if there's a better option out there for them. If they're paying less than $200, in most cases, the retiree plan is probably still going to be the best option for the individual. So that's kind of, again, it's not all cases, but just as a guideline, that's a starting point. You can look to see if you're paying more or less than $200 per month. And the next thing we look at are the prescription drug costs. This is very important when we look at a retiree plan and compare it to Part D of Medicare, since a retiree plan does not have what's called a donut hole or a coverage gap, which does apply to Part D of Medicare. And so that's the second factor. And then the third one we look at is the actual coverage itself. Medicare Supplements is going to give really great medical coverage, where the retiree plan may have a deductible or high deductible or copays or coinsurance. The supplements we recommend generally don't have a lot of out-of-pocket expense. So that's it. Those are really the 3 things that we look at to determine if the retiree plan is right for the individual or if they should move to Medicare Supplement and a Part D plan. So I just want to quickly go through a couple of examples. These are actual examples from the past week and a half to 2 weeks. This is a husband and wife example, and this happened to be a state employee retiree plan. They did not work the number of years required for the full medical benefit. And so basically they're paying over $900 a month in their current plan premium. And they wanted to do some analysis to see if they're overpaying for the retiree plan in comparison to a Medicare supplement and a Part D plan. So the first thing we look at, like I said, is the premium. So they're paying $910 a month right now. With the Medigap plan that we would recommend, Plan G, they'd be paying $134 for the wife and $154 for the husband for the per month premiums. The next thing we have to factor in are the Part D plans. There's no separate prescription coverage with the retiree plan, so there's no additional premium that's required with that retiree plan. But on Part D of Medicare, we did the full analysis to see which is the right Part D plan. The wife's plan would be about $30 a month, and the husband's about $20 a month in premium. So if you add up the total premiums, and then you multiply it times 12 to get the annual premium, the premium savings is huge. For the year, it's almost $7,000 that they're going to save in premiums for the year. But the next thing you have to look at, and this is, like I said, why we look at that second step, is the prescription drug costs. With the current plan, they're paying about $100 a month in drug copays, specifically on the husband's prescriptions. And with the new plan, the Part D plan, their Medicare medication cost is going up significantly. So they're looking at annually, if we add up the premium plus the cost of the drugs, with their current plan, they're about $12,000 total, $12,120 total for the year. With the Medicare plan, if you add up the premium of $4,000 plus the cost of the drugs, which is another $4,400, $4,500, their total cost is $8,600 for the year. So they're still netting out over $3,000 a year in savings moving to Medicare. So this is an obvious case for moving forward. Again, they're saving almost $7,000 a year in premium, but they're giving some back in prescription costs, still netting over $3,000 per year. So that's just one example of a husband and wife from a recent case that we saw. And here's a single individual example from a case from last week. This individual was working at a major organization, and the premiums for the retiree plan, in this case, it was for the individual was $400 a month. So we do the same analysis. We look at the cost of the supplement plus the Part D premiums and determine how much are they saving on the premiums for the year. In this case, they're saving about $2,500 a year just on the premiums for the supplement and the Part D compared to the retiree plan. But we also have to look at the drug costs. And he was paying about $150 a month copays on his current plan. And with the Part D plan, it's actually going to be a little bit less, about $1,400 for the year for the Part D plan. So he's actually getting some incremental savings there. And the net cost total with the retiree plan would have been $6,600 for the year. And with the supplement and Part D, it's about $3,700 for the year. So net savings over $2,800 for the year. And this individual as well is going to proceed with the supplement and the Part D plan and realize that savings of almost $3,000 per year. And that's it. So we want to make sure that if you're on a retiree plan, that you're doing this proper analysis, taking a look at what the cost would be moving to a Medicare supplement and a Part D plan. We'd love to help you out with the cost comparison. You can find on our website, there's a form you can fill out with some basic information if you'd like us to do a full cost comparison for you. We'd be happy to do so, free. There's no cost for that. And we also would ask that you, if you're interested in more content, you're welcome to like us on Facebook and also subscribe on YouTube to make sure you're getting the most up-to-date information about senior advisors and your Medicare needs. Hope you have a great day. Thanks.